Hey everyone, welcome. Today we're going to talk about a health issue that, affects a lot of women but is still kind of misunderstood. And honestly, it has a really strange name, the chocolate cyst. So let's just jump right in and figure out what that's all about.
Yeah, you heard me right. Chocolate cyst. Sounds weird, doesn't it? Maybe even a little appetizing? It's not. So the big question right off the bat is, what on earth is a chocolate cyst? Let's crack this one open.
But first, just to give you an idea of how common this is, ovarian cysts, and that's the bigger category that chocolate cysts belong to, affect, get this, 1 in every 5 women in India. 1 in 5! That's a huge number, which is exactly why we need to be talking about this.
All right, so let's get technical for just a second. The real medical term is an endometrioma. So why the chocolate nickname? Well, it's pretty literal. It's all about what it looks like. The cyst is filled with old blood that's gotten thick and dark brown, basically resembling melted chocolate.
Okay, so we've got the medical name, and we know where the whole chocolate thing comes from. But that just leads to the next logical question, right? How does one of these things even form in the first place?
It really boils down to a 3-step process. So, step 1. Some of the tissue that's supposed to line the inside of your uterus actually ends up in the wrong place. It attaches itself to an ovary. Step 2. During a menstrual cycle, that tissue does what it's programmed to do. It bleeds. But here's the problem. It's in the ovary, so that blood is trapped. It has nowhere to go. And that brings us to step 3. Month after month, this trapped blood just builds up, gets old, and eventually forms the cyst we're talking about.
So you might be wondering, what causes all this to happen? Well, a lot of it seems to point back to our modern way of life. Things like not having a proper daily routine or unhealthy eating habits. And it's most common in women who are between the ages of 25 and 40.
Now that we have a better idea of the what and the how, let's talk about symptoms. And a good way to think about these is like they're clues. Clues your body might be giving you that something is up.
And here's the thing that makes it so tricky. In the beginning, you might not notice anything at all. No signs, no symptoms, nothing. It can be completely silent, which, makes it really hard to catch early on. It's only as it progresses that those clues start to show up.
So what are these clues? Well, some are pretty general, like pain in your lower back or pelvis, or pain during intercourse. But a lot of them are tied directly to your period. We're talking irregular cycles, periods that are way more painful than usual, a really heavy flow, and even menstrual blood that looks super dark, almost coffee-colored.
All right, let's say some of those clues are sounding familiar. What happens next? Well, that's when it's time to bring in the professionals to start a real investigation with a proper medical diagnosis.
To get a definite answer, doctors have a few key tools. It usually starts with a pelvic exam. From there, they'll likely do a pelvic sonography, which is just an ultrasound to actually see what's going on. In some cases, they might need an even closer look, using a procedure called a laparoscopy, and sometimes they'll do tumor marker tests. All of this is to figure out the cyst's exact size, location, and how severe it is, which is totally crucial for figuring out the best way to treat it.
So once there's a diagnosis, what's the game plan? Well, today we're looking at this from an Ayurvedic perspective, which is a traditional system of medicine from India, and it has a really comprehensive approach.
In Ayurveda, it's not a one-size-fits-all kind of deal. There are 2 main paths you can take. On one side, you have Shodhana Chikitsa, which is all about purification. The goal here is to get to the root cause and clear out any toxins. On the other side, there's Shamana Chikitsa, or palliative therapy. This path is more focused on calming down the symptoms and rebalancing the body using things like herbs and lifestyle adjustments.
And speaking of that purification path, one therapy that gets a special mention is panchakarma. The idea here is that, when it's done under a doctor's guidance, of course, this therapy can bring some serious relief from the symptoms, and even more importantly, it can help prevent some of the bigger complications down the road, like infertility.
Now, treatments are obviously super important, but what if we could go one step further? What if we could prevent the problem from ever taking hold in the first place? That, right there, is the ultimate solution.
Look, we've all had this saying 1,000 times, but it is so true, isn't it? Prevention is better than cure. And when we're talking about health issues that are so closely tied to our lifestyle, this simple idea is probably the most powerful piece of advice there is.
So how does Ayurveda suggest we do this whole prevention thing? It really comes down to 3 key pillars. First is dinacharya, which is basically about having a solid, structured daily routine. Second is ritacharya, which means adapting your lifestyle and what you eat as the seasons change.
And third is Rajaswala Paracharya, which is all about a proper routine for self-care during your period. The thinking is, if you follow these practices, you can help prevent not just this issue, but a whole host of other menstrual disorders and just live a healthier life.
And that really brings us to the final thought I want to leave you with. It's a question for all of us, really. By making conscious choices, by living a healthier lifestyle, and by really listening to our bodies, do we actually have the power to avoid diseases like this? The Ayurvedic perspective seems to suggest a big yes, and that's some serious food for thought. Thanks so much for joining me.